Welcome to the Calhoun County Joint Information Center briefing for Wednesday, May 5th, 2021. Administrative notes. Our unified command team. Joint Operations Center, the lines of effort and priorities. Purpose of the Joint Information Center, or JIC. And here's our agenda. Starting off with the current situation report is Eric Pessel from the Health Department. Eric, the floor is yours.
Hey, thanks a lot there, Dirk, and good afternoon, everyone. So the first slide here is is depicted what we've seen all along. It shows our cumulative cases, positive COVID cases throughout this pandemic. And you can see all the way to the right of the screen where our 7-day average of cases is starting to come down, so that this last surge that we started to experience in early March appears like it's headed in the right direction, which is great news. However, I would like to point out that our current hospitalizations in Calhoun County, we have 36 COVID patients as of today. And that's a little bit slightly higher than it was last week, and is still a concern, especially when we take into account that at least in the past week, we've had somebody between the age of 20 and 29 in the hospital in the critical care. We've also had a teenager in the hospital in the last week and a half. Both of those are issues that we did not experience in the previous, back last summer or this past fall. We didn't see it affecting our young people like we are now. Now, for the most part, we're still seeing an older age group that is hospitalized, but we are starting to see some younger folks that need to be hospitalized, and that is a concern, and why we still need to follow good safety protocols, wear masks and stay socially distant, and try to avoid large indoor crowds. And our death numbers are now up to 253. Next slide. So talking about vaccines and where we're at as a county, we are a little below the state of Michigan's overall vaccine rate. We are at about 43.5% of our citizens have received at least the one dose, what they call the initiation. And as you can see, about 35% have completed. And that's, as the graph shows, you can see where we're flattening out there on the right side of the graph over the past, I would say, 2 weeks, maybe 3 weeks. And, we're going to talk about that a little bit more in a couple slides, but that is a concern that we are really slowing down on any new folks coming in to get vaccinated. And so anybody listening or watching this today, we need your help, and we need you to talk to people, make sure they're getting good information. There's a lot of misinformation out there in the internet. Make sure they're getting good information, talk to their doctor, talk to a provider if that's what it takes, but they need to get good information and then come down and get a vaccine. Next slide. So the governor had announced this, I think it was last week, the My Vac to Normal Challenge. And this is why it's so important that we, in my opinion, if we want to get through this, and for me personally, I'd like to go to a college football game, with a full stadium this fall. But for us to do that, we're going to need to reach some, certain goals. And you can see as we go up in first dose percentages, more things open up. And this is laid out pretty well, I think, last week. I just would point out that if we get to 70%, and this is first dose 70%, pretty much everything will be open. And that's a goal we all should be shooting for. I know the president just came out yesterday, I think, and he wants us to hit that by July 4th. We can do that. We can accomplish that in Calhoun County, but we have to start seeing a whole lot more people come down to get their shot. So again, like I said, there is a carrot here that if we can get folks to get that shot, get good information, and come on down to one of our open clinics, or go to your local pharmacy, or go to your doctor to find out the best way to get your shot. I strongly recommend that we do that. Next slide. So where we at? Today, we're at Woodland Church off of Helmer Road from 3 to 6. You don't need an appointment. You just drive up in your car, you roll your window down, you roll your sleeve up, and we'll get you vaccinated today. It's anybody 16 years and older. If you are 16 or 17, you need to be accompanied by your parent, and it'll be the Pfizer vaccine today. Next week on Monday, we have an event out at JB Whiskey's. It's going to be outdoors, and there's going to be, I think, a band maybe later on at night going to be playing, and some food and some good times, and we just want folks to come on out and be able to get vaccinated there. So we'll be there next Monday from 3 to 7. And then next Wednesday, we'll be at the Marshall Opportunity High School in Albion from 10 a.m. to 1 p.m., providing Pfizer vaccine there to anybody 16 years and older. That Monday, I should mention that Monday event at JB Whiskey's is a Moderna vaccine event. So it's only 18 years and older. That's all it's been emergency approved for. And the return date on that will be 4 weeks later, 28 days. So it'll be on June 7th. Next slide. And my last slide of the day, this is, we heard reports in the news, and we're getting reports from our state and the CDC that an approval for the Pfizer vaccine from ages 12 to 15 is on the horizon. We expect it maybe as soon as the end of this week or early next week. And if that's the case, we'll have a whole different population that we'll need to try and see if we can get vaccinated between now and when they return to school next fall. But just a little bit about the age group. You can see in the box on the right, this is Calhoun County data for minors through May 4th. Basically what I see when I see that, I see 60% of our cases are age 12 to 17. And that's really where this vaccine will help support and be able to reduce the the risk to that age level and that age group. So we had great information from Pfizer on their study, and it looks like there's going to be able, like I said, probably sometime next week, we'll be able to start providing those vaccines. We're excited about that. And I think as our data shows, that's a group that we needed to get in front of, especially as we go into the summer. And like I said, before fall school starts. And I think with that, Dirk, that is the end of my slides.
Okay, very good, Eric Pessel. Thank you for all of that information. We appreciate it. Coming up next to discuss Calhoun County COVID-19 temperature survey is Calhoun County Administrator Kelly Scott. Kelly, take it away.
Thank you, Dirk. As you've just heard from our health officer, probably the most frustrating issues that are facing our Joint Operations Center right now relate to the significant slowdown in our community's willingness to get vaccinated for COVID-19. It's hard to believe just a couple of months ago, our biggest frustration was trying to get enough supply and get the lines down. So we're in a different spot. And so as such, one of our biggest jobs as our response team is to change our communications, change our strategy as the situation changes. So to help us better understand what our residents are planning and thinking about with their personal choice to take the vaccine or not, the county recently conducted what we called a temperature check survey hosted by a company called Zen City. And so I am going to do a quick plug for Zen City. Last year, one of the what I'll call a best practice ideas that I got from discussions with other county administrators across the state is to engage Zen City to help us with communication strategies. And at the time, especially related to our pandemic response efforts. Zen City is a global consulting firm, and their only client base is local governments. So their company was formed mainly by former government officials, and they believe very strongly that local governments are the most important civic institutions and that because we provide the most essential services from public health to safety, that we are best positioned to improve the quality of life. And of course, I tend to agree. Zen City helps with civic engagement by searching for, compiling, and analyzing conversations by our residents that come out in the media and social media channels. And they look at both sources that are hosted by the county, so our website, our Facebook posts, and also sources external to the county, like our local TV stations, newspapers, radio stations. And then they serve up that information all about different local government topics, and it's in real time. We get daily, weekly, monthly summaries, graphs, all kinds of analysis that our PIOs, Lucy Blair and I at the county level, and also our partners through the Joint Operations Center, can monitor and hear from and understand what our community members' needs and priorities are and how they're changing over time. We're actually paying for the first year of Zen City's contract using federal COVID relief dollars because many of the topics we're asking them to analyze are related directly to our emergency response. The temperature survey is one product that we thought might be useful for our unified command team. And here are some takeaways from that survey that we conducted basically for about 3 weeks, end of March through most of April. A large percentage, about 73% of our residents, those who took the survey, expressed eagerness to get the COVID vaccine quickly, which was encouraging. It was surprisingly higher and better than the level of willingness that some of the other recent national survey sources are reporting across the United States. We did have 13% respond that they were not planning to get vaccinated, which is about the same as what we've seen the national average. Again, you know, this is a few weeks ago that it was completed. Not surprisingly, the primary areas of concern are just the newness of the vaccine, the intent of those who created it so quickly, and then the possible side effects. Those items are going to require some ongoing education and just time as more data becomes available. And honestly, as people continue to talk with their family and friends about what the typical side effects have been that they've experienced, we think that will help just with some time. The majority of our respondents were between 25 and 54, and then the higher category of age 55 to 64. So only a very small portion were younger than age 24. And most of them were in our urban areas within the cities, not as much rural response, which is understandable given that it was an online survey. So one takeaway that we're working on is that our online survey and this chosen distribution channel didn't necessarily reach our younger residents. And you heard Eric Pessel talk about younger residents being an audience that that we need to reach better to get more vaccinated, and we need to work on more successful ways to communicate to our young adults about the vaccine availability, about the convenience, and about its effectiveness. Also, we saw that resident trust in the vaccine is high, which is good. So Dr. Nettleton and others have done a good job. Those who don't have trust are concerned about the interests of the people who developed the vaccine. So just kind of the general, I think, frustration and lack of trust in the government, in our health officials. And then, of course, as I mentioned, a big portion are concerned about possible side effects. A couple of the other takeaways that might take some time for us to address are that a vast majority of our respondents, including myself, want to know how long the vaccine immunity will last. And they want to better understand information just about vaccination rates and how that relates to reaching what we're calling herd immunity. To that end, we asked respondents where they usually get their vaccine information from. We asked them, do they look at local news sources, online, television? And so what they responded that official health resources were a key source, including the county's website, even more than our county social media, And surprisingly, the least popular sources were some that we've actually thought about, trying to help us with a vaccine campaign. They reported a less popular source being religious leaders, search engines such as Google, and then doctors, which I was surprised at that. And so we can see with the number of people that share information on the health department's Facebook site about walk-in clinics, for example, that people do see that as a reliable source of information. So we're going to continue using the communication channels that have been successful based on this survey. And we also recognize and really thank our local media as a tremendously useful source to reach people in our community as well. And so before I turn it over to our city partner, Rebecca Fleury, to talk about a couple of major concerns from the survey, I just want to mention that based on our temperature check survey, we do have some actionable items that we can try. And I want to echo what Eric Pessel said, that we invite ideas from all of you, from our media sources, from our local elected officials, on how to increase the number of county residents that get vaccinated. And I understand that part of the hesitancy may be related to frustration, even anger, that some of the messaging we're hearing is that we need to be part of, what sounds like a government solution. I would say, even if, that is not something that you're interested in, helping the government, that, this getting vaccinated to the percentage necessary to help public on a community-wide basis is really, right now, what we're hearing, the only way to help us be more free from gathering, free from mask restriction, and to truly help open up and rebuild our economy. So with that, I'll turn it over to Rebecca for the next slide.
Thank you, Kelly. I appreciate that. Great data and information that we are receiving from that countywide temperature survey. So thank you to the county for leading in that area. But certainly, as expected, there were certainly some concerns raised from that survey. I think as one of the members of the Joint Operations Center, what we felt good about is these were things that we had already been thinking about. Certainly, it was helpful to know from the community that vaccine equity and after work vaccine availability were concerns. And we feel like we had been talking about them and taking some action on them, but also continuing to work through those so that maybe they won't be a concern going forward. So in regards to vaccine equity, we have been, the Public Health Department in Calhoun has been working with community partners and neighborhood organizations to make sure that our communities of color in Battle Creek and Albion have vaccines available to them. So through micro clinics, door-to-door education, just alternative places to get vaccines have already happened and certainly are being planned for the future. So offering vaccines at the Burma Center and Washington Heights Church are just a way to try to address the concern around vaccine equity in Calhoun County. The other after work vaccine availability, I think you heard Eric talk about some after hours clinic options even today at Woodland Church, but just offering outside of normal work hour vaccine clinics that may assist those that they're in school or they're working during the 8 to 5 time. So finding other time slots as well as locations to offer those drive-up clinics and other drop-in clinics. Places such as the Kellogg Community College, the Dexter Lake Church, in Harper Creek, and then also holding vaccine clinics on the weekends, because we just know that Monday through Friday can be very busy for families and for residents in Calhoun County. So working to provide alternative days in the evenings outside of work hours. And then the drive-through clinic. I appreciate Eric said, all you have to do is drive up, roll up your sleeve, you get your shot, wait your allotted time, and you are off and going on your day or your evening or whatever. So really appreciate the feedback on the survey and doing everything we can to address a couple of the top concerns being vaccine equity as well as after work vaccine availability. Next slide, please, Dirk. So many of us have already seen that new guidance and orders came out from the Michigan Department of Health and Human Services. They will go into effect May 6th through May 31st. And the subject is around gatherings and face masks in the the epidemic order, excuse me. So just going through some of the new points, masks are not required for outdoors unless a gathering has over 100 individuals. Masks are not required for fully vaccinated individuals at residential gatherings. Masks are not required during active practice and competition for non-contact sports that are played outside. That certainly impacts our high school sport participants. Residential gatherings can go beyond the current cap of 50 individuals if you can space people, 20 persons per 1,000 square feet. And then fully vaccinated youth athletes no longer need to undergo routine screening tests for COVID-19. MDHHS has they do a really good job with their graphics. So if you take a look at the one that's listed on this particular slide, and you can also find it on MDHHS website, and there's links on the county's website as well as the city's website, it gives you just a little graphic depiction of when you do and don't have to wear masks. So I just caution in that, these are new guidances, but as Eric Pessel mentioned, we are still seeing elevated hospitalizations. We still have cases, we receive, double-digit cases every 24 hours. And, this is the time, while yes, we can have a little bit of relaxation around mask wearing, we still need to be as diligent as we can be with our hand washing, making sure we follow the mask orders that are currently in place, particularly for those that begin tomorrow, as well as social distancing whenever we can. And I appreciate what Eric said too, is really we need to avoid those large indoor gatherings. And make sure that we're spacing out even when we're outdoors gathering in groups. That's all I have. Thanks, Dirk.
Okay. Kelly Scott and Rebecca Fleury, thank you so much for your reports. We appreciate it. Coming up next is comments from elected officials, and we'll begin that with Senator Bizon.
Hi, everyone. This is Karen from Senator Bizon's office. The Senator is in Appropriations Committee this afternoon. They're looking to vote out some departmental budgets this afternoon. I don't have anything COVID related legislatively. I did want to mention the opening of applications for the Restaurant Revitalization Fund for restaurants who are looking to be able to apply for that. It is opened on Monday. And if you need further information on that, you're welcome to contact Senator Bizon's office. And that's all I have. Thank you.
Okay, Karen, thank you so much for that report. We appreciate it. Up next is Representative Hatzma.
Hi, Dirk. I don't have to offer from a legislative perspective either. I appreciate the information shared by all the participants on the call. Thanks for keeping us well informed.
Jim, thanks for your thoughts. We appreciate it very much. Representative Hall. And county elected officials. Moving on to tribal elected officials. And city elected officials. Township elected officials. And finally today, village elected officials. Okay, we'll go to the next slide. Our best information sources are listed. And next slide, our final slide, contact us for more information. Lucy, Victor, Jessica do a fine job. And that's all we have today. We appreciate everybody tuning in and listening to the reports today. Please stay safe and enjoy the rest of your week. Take care.